So I'm really pleased to have been invited to participate again in this very impressive event. I'm Dr. Valerie Yerger, UC San Francisco professor in health policy. I'm one of the original tobacco documents researchers, focused primarily on the tobacco industry's targeting of African American communities. So I've been asked to provide an update because we have some really exciting things that have been happening around menthol cigarettes, not only here in San Francisco, the state of California, but the country as well. And I will move quickly through that part so that I can then switch over and talk about stress and ways to cope with stress. And I hope that it will piggyback somewhat on what Monique has very eloquently shared with us. So this is just a quick outline of what I will be talking about. And I do want to stress that the part that I will be sharing regarding coping with our stress is based on a technique called emotional brain training. And I have introduced this concept in the past, and I was asked specifically to talk about the brain state. So I hope to provide some additional information about it. Let me quickly just talk about the importance of not giving up on the great work that we've done around educating and advocating our community about the need to address tobacco and our specifically in the African American community. California's tobacco control program is actively pursuing the end game. And they hope to do this by the year 2035. And what that means is they are putting resources and efforts into ending tobacco use, ending the sale of tobacco, and also getting rid of the tobacco industry's presence in our state. And so if we are going to really move in this direction to eliminate the epidemic, we have to make sure that we don't leave anyone behind. And so it's going to really require thinking outside of the tobacco control box and implementing policies that are going to really be equitable and driven by a health equity lens. So I do want to let you know that this is actively going on and why it is we can't give up on tobacco at this point. So we know that tobacco is a critical public health issue. It remains to be the leading cause of preventable death and disease in our country. And we also know that it disproportionately affects many subpopulations. But among all racial and ethnic groups in the US, African Americans bear the greatest burden from tobacco-related morbidity and mortality. Every year, 45,000 African Americans prematurely and unnecessarily die from tobacco-caused diseases. An estimated 85% of them smoke menthol cigarettes. And so for decades, the tobacco industry has exploited social and economic inequities to foster the uptake and use of menthol cigarettes and to create brand loyalty among African Americans. In this slide, you see a quote that was taken directly out of a tobacco document. I don't need to read it. You guys can see it. But what I will say to you is that menthol is extremely problematic because of its sensory properties that reinforce smoking. It increases the uptake of nicotine and toxic smoke components, and it discourages cessation. And it does that by its cooling, anesthetic, and analgesic effects. And this is extremely problematic for new smokers who are experimenting because menthol cigarettes will ease initiation by masking the harshness and irritation of tobacco smoke, among other things. So I've already introduced to the group last year and even the year before when we were working on these comprehensive policies San Francisco was actually the first jurisdiction in the country to implement a comprehensive menthol flavor ban. And this was through a partnership with SF-CAN, the UCSF Center for Tobacco Control Research and Education, and a group of African American tobacco control activists known as the African American Tobacco Control Leadership Council. And so this comprehensive flavor ban banned the sale of all tobacco products, including the cigarettes, the e-cigarettes, the nicotine juices, all the vaping devices. My colleague, Carol Magruder, who co-chairs the AATCLC with Dr. Phil Gardner, is a member of this CAB for the Office of Community and Community Engagement. So what's important to know is that flavored tobacco policies will benefit the Black community, but they will also benefit other racial and ethnic groups, the LGBTQ community, youth, and those with behavioral health issues, because these are the groups that are disproportionately smoking mentholated cigarettes over non-mentholated cigarettes. Let me just populate this. So my point of showing this slide is that here in a city with approximately 6% African Americans, we were able to get this policy passed primarily because the incredible leadership that we have here in San Francisco. And I just, it's so important for us to understand as a community just how empowered we are and being able to implement policies that directly affect our needs as a community. And you'll see here, Malia Cohen at the time was the supervisor who sponsored this flavor ban ordinance. London Breed at the time was the president of the Board of Supervisors. We had the support of Police Chief William Scott, and Shaman Walton at the time was the president of the school board. He would later join the Board of Supervisors and implement his own ordinance that really went after the e-cigarette and Joel. Since San Francisco passed its comprehensive flavor ban, 78 other California jurisdictions follow suit. So it's been incredible. I want to quickly talk about SB 793 because this is still on the table. SB 793 is a statewide bill that would ban the sale of menthol cigarettes and most other flavored tobacco products. Unfortunately, it does not include hookah, and there's some other exempt products, but the thing about the bill is that it does not prevent local jurisdictions from enacting even stronger policies. But again, it's important to see the support behind SB 793, which was signed into law last year by Governor Newsom. Unfortunately, the bill has been delayed because the tobacco industry has implemented, they filed a referendum, and they did the same thing in San Francisco, where the comprehensive flavor ban eventually went to the voters of San Francisco, and the voters agreed that they wanted to maintain the flavor ban. And so we're in a similar situation with the statewide ban. I share this with you because it will be decided by the California voters in the November 8th election of 2022. And do note that due to this delay, the tobacco industry is generating billions of dollars in profit just from the sale of menthol cigarettes alone, and that there are tens of thousands of high school students and younger students who are initiating smoking. So I was asked to provide a quick update on the lawsuit. After working very hard for decades, African American tobacco control activists have been out there trying to resist a pervasive presence of the tobacco industry and their deadly products in our communities. The FDA was given the authority back in 2009 to regulate tobacco products. They banned the use of characterizing flavors that are favored primarily by white children, but they did not ban menthol cigarettes. And so after more than a decade, the African American Tobacco Control Leadership Council filed a lawsuit against the FDA. And we filed this lawsuit last June, and we did so with the Action on Smoking and Health as a co-plaintiff. A few months later, the American Medical Association approached us and asked if they could join us in the lawsuit as a co-plaintiff. And then December of last year, the National Medical Association approached us and asked to join us. So these are the parties that are suing the federal government. And what we're asking is that they take some action on menthol. I will also say that on April 29th of this year, the FDA, in response to our lawsuit, said that they are committed to taking some action and that they will take a year to basically propose their action against menthol, and not only menthol cigarettes, but also all the other flavored cigars that are being used by our young people. It's important to also know that the enforcement is directed towards the tobacco companies, the distributors, wholesalers, retailers. There will not be any enforcement whatsoever against individuals for using or possessing menthol cigarettes or any of the other flavored tobacco products. And we do this work because we are doing it to protect our future. And so I want to really stress the importance also of understanding that the policy works will have a direct effect on those who are currently smoking. And so as we are implementing these smoke-free policies and flavor bans, we also have to address the demand for tobacco and provide tailored cessation programs. And at the very least, we need to address the use of tobacco as a coping mechanism that many use to deal with their stress. So here's my tie to the rest of my talk that will allow us to talk about stress. And so when I talk about stress, it's not only so that we can identify the need to provide services for current smokers as we implement these policies, but also for our own use as providers, as those who are doing the work to help these policies, and just all the great work that we do in our community is very taxing because if you're like me, you have family members who are in great need and they rely on us. So we're working our full-time jobs, we're volunteering, we're part of organizations, we're part of boards, and we have family members who rely heavily on us. So we all need to really consider how we can take better care of ourselves. As Monique pointed out, she provided some very, very good suggestions. But I want to talk about stress in a little bit of a different way. Our bodies are really hardwired to react to stress in ways that are meant to protect us against predators and other aggressors. For example, when we are in a very stressful mode, it's all about, as you guys have heard, fight or flight, to fight the predator or to flee the predator. And so, for example, the blood rushing to our extremities are extremely important to help us fight or to flee, and not putting, our body doesn't put such a hard focus on digesting food because it's not critical. And so I know many of us tend to eat when we get stressed out. It's like the worst time to eat because it's not a priority for us to digest that food. So I just wanted to share that as an example of how we could be in a fight-flight mode and not necessarily really appreciate how that might be impacting other bodily functions. So stress, we know, is crucial to deal with because it's the root cause of 80% of our chronic diseases. I usually go into talking about the role of cortisol and the effects of cortisol on the vascular system, for example, but I don't have time to do that. Just know that this has been heavily documented to show the relationship between the stress hormones and the chronic diseases that we get as a result. And here's my lovely slide on fight or flight. The thing that we also need to be aware of is that we might be dealing with stress and we don't even know that we're dealing with it. It could be micro sort of effects. And there are some times where we know that we're under a lot of stress, but there are times, for example, working in a very racist society, we get used to it, but there's a part of us that knows that this is not right, and we're dealing with the microaggressions of just being Black or a person of color, or someone who is from a group that is commonly discriminated against. These are things that add up, and we just have to assume that our body is just under a chronic exposure to the stress hormones, and all of this leads to a wear and tear on our various bodily functions. So stress response is normal, but it's not normal if it is chronic. And unfortunately, that is the case for so many of us. And understand that stress comes from unexpected places. I mentioned already the structural institutionalized racism, but just having the news on and hearing a barrage of negative media, emotional baggage, especially from past relationships or current relationships with family, friends, loved ones. We're dealing with intergenerational trauma. So all of these things are impacting us, and it's important for us to understand that we're affected by it. So stress overload, and these are just a few of the diseases that we know are directly related to the constant secretion of cortisol. Some of these have already been discussed, but it's again, our body is just trying to deal with the onslaught. So we know this, we've been talking about it. So what are some of the other ways that we can work our way out of it? Well, believe it or not, we can't always think our way out of stress. And I appreciate mindfulness, the relaxations, all of that has some very important roles that we can use on the spot. But you know what? When we are feeling deeply stressed, our thinking has been shown not to be able to switch off the stress. And we know that, if we're stressed, we've got the stress hormones that are being secreted. We've all been here, we know this. But how do we get to a place where we can turn on the feel-good hormones? We have receptor sites in our brain that are designed for receiving these feel-good hormones, and when we don't have them secreting, we look for other sources such as smoking or drinking, or even gambling. Any of these other addictions that we have are feeding those same receptor sites that are intended for the ones that we can naturally, intrinsically secrete. So how do we take charge to do this? There is really, if you want to have a cool appreciation of it, I usually use my hand. I don't know if you can see this, but if you think of my hand as the size of a brain relatively, and then I make a little dot with the pen, that's actually the size of our thinking brain, that little dot. The rest of our brain is our emotional brain. And there's a disconnect between our thinking brain and our emotional brain. The emotional brain is really made up of circuits that get laid down, believe it or not, by the time we're 3 years old. So our responses to stress are really connected to those neurons that have already been set. So how do we access those neurons, and how do we take control over how it is that we respond? So I was actually introduced to emotional brain training here at UCSF a number of years ago. And emotional brain training, and I'll explain it in a little bit of detail because I have a few minutes left, is was provided to practitioners at UC San Francisco. It was provided to us free so that we could work on our own stress level, so that we would be aware of the stress of our stress level before we went into the classroom with our students, or we went into the clinic with our patients, and so that we could also train them and model them. I so thoroughly believe in this because I am here today because of my having discovered emotional brain training and doing work on my own personal stress level. Our responses to stress, as I mentioned before, are controlled by these brain circuits. And so it's being able to tap into those circuits, and it's very easy to do. And I'm going to take a few moments to share with you. So here are the emotional brain states that I have presented in the past. There's 5 brain states, and they are presented to you anatomically because that's actually where our activity is based on the amount of stress, based on the amount of cortisol that is secreting through us. So when we are in brain state 1, we're not secreting cortisol. When we're in brain state 2, we still aren't secreting cortisol. That's when we are aware in our thinking brain. As we get more and more stressed out and the level of stress hormones increases, it makes us function out of our emotional brain. Now, how do you kind of figure out which brain state you're in? Well, if you're in a brain state 1 or brain state 2, you're not secreting cortisol, as I mentioned. The difference between brain state 1 and brain state 2 is that in brain state 1, you're secreting feel-good hormones. And we all know what that feels like. We know what it feels like to feel joy. And we may not really appreciate the fact that we're secreting some feel-good hormones. Maybe we know that. We definitely have the ability to do that in prayer, when we're meditating, and you can pull yourself up into those brain states by really focusing on those things that bring you joy. As you start to have more stress and you go deeper into your emotional brain, you actually need tools to help you. So one of the things that we do in emotional brain training is we do our check-in exercises. And I've written it down here. You basically take a deep breath. And I know I've been talking fast, and this is not the place to do it, but you take a deep breath, you put yourself in a joyful position, and you warmly observe yourself without any judgment. And then you ask yourself, well, what's my brain state? How am I feeling? Am I feeling great? Am I feeling good? Am I feeling a little stressed? Am I definitely stressed, or am I stressed out? When you're stressed out, you're unreasonable. I don't even talk to my kids when they're in a brain state 5 because I know that they're unreasonable and they will not hear me. And we know when we get into that place. And so with the emotional brain training, there are tools that are designed to help you depending on which brain state you are in. And I would love to be able to have an opportunity to come back and to really practice and show individuals how to use this. But we have cards, and this is being recorded and it will show you. But when you're in a brain state 1, we have something that's called the sanctuary tool, which is basically you just follow the steps that are here. When you're in a brain state 2, you're feeling good, you do a feeling check. You just simply respond to these questions and you feel and see yourself. And then likewise, when you're a little stressed, definitely stressed or stressed out. So instead of using the card, there's actually, I'm going to share with you, the brain-based health is what you search for to get the app for EBT. And so that card that I showed you, actually the app will take you through. I can't stress how important it is to be able to check your brain state and to provide the tools that you need. And there are times when you're really stressed out and you don't want to come out of that. That is okay. You might have a good reason for being stressed out, for being angry, for feeling what you're feeling. But if it's that 3-year-old brain that is automatically responding to the stressful situation you're in, you might want to check that and move out of it. So I am just going to quickly move through here. As you can see that if you're doing any other traditional programs, the EBT technique is a great supplement to it. And just to plan your check-ins, whether you have the app or not, just stop and just do a deep breath and assume your body at 1 and just really ask yourself, how am I feeling? See yourself as Monique taught us to do. And I just want to give a shout out for Lowell's book. Lowell Mellon is the creator of this emotional brain training. It is science-based. It's been rigorously studied. The science is very, very sound. You can get the Stress Overload Solution book on Amazon. It is incredible. And just to let you know, EBT can be extremely helpful for so many of our chronic diseases. And with that, I thank you.